Most people think they know what the flu feels like. They think it's just a few days of discomfort, maybe some sneezing, a little fever, and then everything goes back to normal. But when a high fever hits out of nowhere, when your entire body starts aching as if you've been hit by a truck, and even standing up feels exhausting, that's not a mild illness. And here's the dangerous part. Treating this like a common cold can make recovery take much longer than you expect. In this video, you'll learn how to recognize real influenza symptoms, why so many people underestimate it, and the one mistake that makes the flu knock people down for days or even weeks. Influenza is a viral respiratory infection caused by the influenza virus. Unlike the common cold, it doesn't ease its way into your body. It hits fast. One day you feel normal, and the next you feel completely drained with intense body aches and a fever that refuses to be ignored. And this is where most people get confused. They call it a strong cold and move on. But there is a critical difference that changes everything. A cold is uncomfortable. Influenza knocks you down. A common cold usually comes with mild symptoms: a runny nose, sneezing, a scratchy throat, and some discomfort. You can still function. You can still push through the day. Influenza is different. It affects your entire body. Work becomes difficult. Simple tasks feel overwhelming. Even resting doesn't seem to restore your energy. And the way it starts is one of the biggest warning signs. Influenza often begins suddenly. There is no gradual buildup. The symptoms appear all at once, and they appear strong. The most common influenza symptoms include a high fever, often above 38 degrees Celsius, intense body aches, strong headaches, chills, extreme fatigue, pain behind the eyes, a dry cough, and a sore throat. Not everyone experiences all of these symptoms, but when high fever, body pain, and exhaustion come together, your body is sending a very clear signal. One symptom in particular causes people to make the wrong decision: extreme fatigue. This is not normal tiredness. This is not lack of sleep. It's a deep physical exhaustion, the kind that makes your body feel heavy and unresponsive. And yet many people ignore it. They keep working. They keep studying. They keep pushing themselves. They tell themselves, it's just the flu. I'll power through. And this is exactly where the problem begins. The biggest mistake people make with influenza is treating it like something minor, ignoring a fever, skipping rest, continuing intense physical or mental effort, self-medicating without proper guidance. Your body needs energy to fight the virus. When that energy is spent trying to maintain a normal routine, the immune system struggles to keep up. And when that happens, recovery slows down. In many cases, influenza improves on its own with time, rest, and basic care. But that doesn't mean it should be ignored. Because in some situations, especially in more vulnerable individuals, complications can develop. These complications may include secondary respiratory infections, pneumonia, and worsening of pre-existing health conditions. That's why paying attention to how symptoms evolve is so important. There are warning signs that should never be dismissed: shortness of breath, chest pain, persistent fever that lasts several days, mental confusion, severe dizziness, or symptoms that get worse after an initial period of improvement. These are signals that your body needs medical attention. Every person reacts differently, and only a healthcare professional can properly evaluate what's happening. Many people wonder if there is a medication that can quickly cure influenza. The truth is, there is no instant cure. There is no pill that makes the virus disappear overnight. Treatment focuses on relieving symptoms, staying properly hydrated, resting, and seeking medical care when necessary. And rest is not optional. It is one of the most important parts of recovery. But even more important than treatment is prevention. One of the most effective ways to reduce the impact of influenza is annual vaccination. The vaccine does not prevent every single case, but it significantly lowers the risk of severe illness and complications. It prepares the immune system to respond faster and more effectively. In addition to vaccination, simple habits make a real difference. Washing your hands regularly, avoiding close contact with people who are sick, keeping indoor spaces well ventilated, practicing basic hygiene measures. Despite this, many myths continue to circulate and cause people to neglect proper care. One common myth is that influenza is just a stronger cold. Another is that only elderly people or those with health problems can be affected. The reality is that anyone can get influenza, including young and healthy individuals. Another widespread myth is that the flu vaccine causes the flu. What may happen is a mild immune response, which is not the disease itself. Confusing these reactions leads many people to avoid protection altogether. Understanding how influenza spreads also helps explain why it affects so many people every year. The virus spreads mainly through the air in droplets released when talking, coughing, or sneezing, and a person can transmit the virus before realizing they are sick, which makes prevention more challenging. Many respiratory viruses share similar symptoms, which is why confusion is so common. The key difference with influenza is intensity and speed. When symptoms appear suddenly and hit hard, especially with high fever and body aches, that's a sign you shouldn't ignore. Ignoring warning signs does not make the illness weaker. It does the opposite. Your body communicates clearly when something is wrong. Listening to those signals can make a significant difference in how quickly and how well you recover. So here's the most important takeaway. If your symptoms started suddenly, if you have a high fever, if your body aches are intense, and if your energy feels completely drained, don't treat it as something trivial. Influenza is not just a cold. Your body needs time, rest, and proper care to recover. If you've ever had an illness that completely knocked you down and left you without energy for days, you already understand how serious this can feel. Sharing accurate information helps others recognize the signs earlier and make better decisions. Information is also prevention. This content is for informational purposes only and does not replace guidance from a healthcare professional. If symptoms worsen or if there is any doubt, seek appropriate medical care.